As a GP, you see many people with long-term conditions, and recent statistics indicate that this group accounts for about 50% of all GP appointments and 70% of all NHS appointments. Yet despite this, many people with long-term conditions are not served well by the current, more traditional health service approach, which can be disjointed and uncoordinated and results in unnecessary emergency admissions. GPs also tell us that the current system is not working well for them either. The current 10-minute GP consultation encourages a doctor-led approach where there isn't time to properly engage with people and to fully understand their condition. A person-centred healthcare approach gives people with long-term conditions more choice and control in their lives through shared decision-making, self-management and care and support planning, working alongside you and your medical expertise. This ultimately helps people achieve better health and well-being outcomes. This approach is part of a wider whole-population personalised care model, which delivers a scaled approach to person-centred care depending on the complexity of their need. People with long-term conditions and complex needs form 30% of the population, a significant number. This approach can also reduce pressures on the system and brings increased professional satisfaction to you as a GP. As the first point of call, you are uniquely placed to offer people this more personalised approach. From a GP perspective, personalised care involves a change in the relationship between the health professional and the patient, which involves a different conversation that shifts from asking, "What's the matter with you?" to "What matters to you?" So what would this look like in practice? One local GP recently saw Peter, who is 69 years old and has severe ongoing COPD, which has resulted in many ongoing GP and hospital visits. Recently, Peter's wife died and he is not coping well. The GP has already identified Peter as a person living with a long-term condition and as a regular patient. Before his appointment, the GP practice sent Peter an agenda sheet so Peter could think about what he would like to talk about. At the appointment, Peter said that he was feeling depressed, lonely and a bit anxious, as well as not being able to take his medications regularly. Working alongside him, the GP had a care planning conversation with him, which addressed his key concerns and suggested some possible options. They agreed that Peter would now attend counselling and join the GP's COPD support group. The GP also organised for the local pharmacist to review his medicines and to provide a med box so Peter could take his medicine more easily and not get confused. In addition, the GP asked the care coordinator to put him in touch with some social groups, including the local Military History Society, so Peter could meet with other people with similar interests. Some practices have link workers that can also help in this way. Finally, the GP and Peter agreed to touch base by phone in 2 months' time. 6 months later, Peter is feeling a lot more positive and in control of his life. He has made new local friends and has not needed to see the GP during this time or attend A&E. So person-centred care engages and empowers patients to take an active role in managing their own health and well-being, working alongside your medical expertise and that of other professionals. This person-centred approach helps to improve lives and reduce pressure. You as a GP can have the increased professional satisfaction of knowing that your patients are receiving the care and support that they need.